Hi, welcome back to our channel. I'm Dwayne. One of our other video segments, we talked about hip impingement, but we talked about it from a functional standpoint. Today, I just wanted to educate and talk to you a little about the bony changes, or FAI as we call it. And we'll go a little bit more into depth about the actual bony changes that happen. So there are three different types of bony changes that we can have when it comes to that sort of bony change, hip impingement. The first one is a pincer, and that's when the hip socket starts to get a slight overgrowth here. So as the bone sits in there, the ball sits in there, and we roll up, the socket overhangs a little bit and will actually pinch the structures of the femur. The second one is called a cam change, and that's when the ball is abnormal shaped and it's not completely round, and there will be a slightly oblique shape, if you want to call it that, where there's a little bit of an edge on the ball. So instead of the ball being round, you can think of it as a little bit more nubby. So as it shifts and we're trying to bend that knee up toward our chest, it'll pinch a little bit sooner. The third is called a combo, and that's when you have a little bit of both going on. So you can see how the combo can be slightly worse than either, but again, it's going to depend on how much of the growth you have on either side that can dictate your symptoms. If it is really bad, it doesn't really matter some of the exercises you're going to do, you're always going to have that pinching. And that's when you need to consult with your physician or your doctor or an orthopedic surgeon, and they can talk about your options there. So we're gonna go over some exercises that you can do, and if these exercises don't help at all, definitely go and see your physician, and they can point you in the right direction of what the next steps are gonna be. One of the major things that we need to be able to control when it comes to hip impingement is our pelvis. So this exercise is learning how to posterior pelvic tilt or rotate your pelvis backwards. That also does help neutralize the spine a little bit, but for hip impingement, it's very important to get the pelvis in a more neutral position. So this exercise, we're gonna start very basic, and we're gonna bend the knees here, get into the hook lying position, and he is going to rotate the pelvis and try to flatten his lower back onto the table. What that does is, notice how that rotates the pelvis, right? This would be relaxed, and then he rotates the pelvis back, and that allows more space in the hip joint to be able to move around. He's gonna hold that for about 10 seconds, do about 10 repetitions. If this gets easy, the next phase is we're gonna be straight, down, flat, and then we're trying not to press the legs into the table with this one, and we're gonna tilt up there. Notice how his pelvis again rotates back, but he's not driving his legs and using his hips to do it. We're trying to control a little bit more with the core. Then the most advanced for this that I wanna talk about today, we're gonna be up and our feet are gonna be floating here, and then he's gonna try and rotate back up. Notice how he can rotate. We're gonna hold this for about 10 seconds, and then we're gonna relax. If you feel like that is too challenging, obviously that's the most advanced for now. So start from the beginning. I want you to be able to do all 10 first before you advance to the next step. We also are gonna show you different ways to try to do this in different positions coming up right next. It's really important that we can do this in multiple positions, because the hip can impinge when we're walking, when we're sitting, when we're laying down, when we're doing multiple different things. So being able to control the pelvis in all of these different positions is very, very important. So standing, It's a little bit different of a cue and it's a little bit of a different feel, so we also have to practice it in standing. Notice Nate here, he stands with a natural resting, slight extension of the lower back, right? And if he was having hip problems, that could potentially lead to a little bit of a hip impingement. So what Nate's gonna do is he's just gonna slowly try and tilt that pelvis, and he's using the glutes and squeezing the butt muscles, but also trying to use his deep core muscles to help pull that and rotate. Notice how his back is a lot more neutral at this point. And then when he relaxes, it goes back into that tilted position. So when you are standing, you want to practice in being able to rotate that back and keep that pelvis in a neutral position as much as you can to gain that control there. So if you're getting the pinching in your hip when you're sitting, this is a really good way to help decrease that pain. So learning how to tilt the pelvis in the sitting position is going to be really important. So notice how Nate is sitting here. His spine's actually not that bad, but what happens for a lot of people as we sit, our core and our muscles sort of relax as we're sitting there, and we'll actually go into either an anterior pelvic tilt or we'll fall really, really deep into this hunched position, and neither of those are really that good for sort of hip impingement, okay? So all you're gonna do is you're gonna practice in sitting, you're gonna practice tilting back with a neutral spine position, so staying upright and not allowing our back to sort of slump. And then we're also gonna come out of it and go into a slightly more neutral position, right? So we're gonna relax, if you wanna call it that, but staying upright. So we're gonna rotate back, and being able to practice in this position is very important. It's really important that we have flexible hips on the front side of our hips to allow our pelvis to get into that neutral position. So the hip flexor stretch is a really good way, and there's multiple different ways, but this is pretty easy setup to do. So you can do this, pretty much almost anywhere. So you're gonna get in a slight lunge position. You're gonna drop a foot back here. Then what we're gonna do is we're gonna tilt that pelvis backwards, see how the hips engage and the pelvis becomes neutral. Then we're gonna shift the weight forward like that, and then you'll get a little bit more of a stretch there. When we do this, we wanna make sure that we are getting that pelvic rotation rather than staying anterior like this, because then we won't get as much of a stretch there. We want to hold this for about 30 seconds on each side. This exercise is a hip hinge or RDL with a band to help focus a little bit more on using the glutes and learning how to hip hinge versus allowing your back to move around. That's really important to learn how to open and close the hip when we're dealing with a hip impingement. So first thing, we need a little band. I use a long loop. It doesn't have to be really heavy because you need to be able to stretch it. So we're gonna set it up and anchor it about hip crease height. And then he's gonna step through here and we're gonna line that up about hip crease. Then we're gonna walk that out so there's some tension on the band, right? And if you watch his hips, he's in that natural resting anterior pelvic tilt. What we're gonna do is we're gonna tilt that and neutralize the spine, perfect, so the glutes engage. And then we're gonna hip hinge and slightly bend forward. And then when we feel tension in the hamstrings, then we're gonna squeeze our glutes and stand back up. Notice how he doesn't arch back into overextension, and he can stay in that neutral position. We're gonna bend forward. We're gonna feel the stretch in the hamstrings, really controlling the lower back so that doesn't round, and then engaging the glutes to come back up. Notice how he's keeping the pelvis in a neutral position. We're gonna do this for about 10 to 15 repetitions. Those are some exercises that you can do to help alleviate the hip pinching. I recommend to do them 2 to 3 times a day. If you try them for 3 or 4 weeks and they don't really help, I recommend that you go and consult your doctor so we can get a little bit more diagnostics done to hopefully show that you don't have one of those bony changes, or maybe you do have one of those bony changes and they can direct you to get help. Thanks for watching the Valley Rehab YouTube channel. Please like, subscribe, and drop a comment. We'd love to hear from you.